This is a community analysis of Largo, Florida, presented by Victoria Coyle. The objectives of this community assessment are to give a brief overview of the history of Largo, Florida, and provide a community analysis of the community of Largo that focuses on the structure of community, such as how History of the community of Largo. Largo, Florida was originally inhabited by the Timucua Indians, one of the 4 major tribes of Florida. While the area was originally discovered by a Spanish explorer in the 1500s, most homes in Largo, Florida are single-family homes. There are also many apartment complexes and mobile homes in the community. Homes in the community seem to be mostly occupied for the middle class or below. The houses and apartment complexes There are many places of worship in Largo, Florida. The ones provided on this slide were selected due to their community involvement. Abundant Life Ministries provides many services to the community, including outreach programs for The major roads in Largo include US 19, Ulmerton, Belcher, and Starkey Road, as well as East Bay/Roosevelt Boulevard. For the most part, the roads are well maintained and traffic peaks during the normal working. Major grocers in the community include Publix, Walmart, Neighborhood Market, Winn-Dixie, Save-A-Lot, and Aldi. Bulk grocers include Sam's Club and Costco. However, a yearly membership for a Currently, there are 84,754 residents in Largo, with the majority of residents being 19 to 64. There are also just under 14,000. While the community of Largo is diverse, the majority of the population are white, followed by Hispanic or Latino individuals and African Americans. Minority groups exist amongst American Indian, There is a cyclical relationship between unemployment, poverty, and education in the community of Largo. Currently, the unemployment rate is at 3.5%, while the persons below Priority community health issues in Largo, Florida include housing, poverty and homelessness, healthcare disparities and healthcare access, culturally competent care, communicable disease. Communicable diseases prevalent in Largo, Florida include influenza, pneumonia, shingles, herpes, chickenpox, gonorrhea, hepatitis C, chlamydia, measles. Smoking is the leading preventable cause of death in the United States, causing more than 480,000 deaths each year. Smoking causes about 90% of all lung cancer. Community health services are a vital asset to every community. In Largo, the Community Health Centers of Pinellas Clinic is open Monday through Friday from 8 to 5. Services provided include medical, dental, social services are a fundamental resource for any community. In Largo, Lighthouse of Pinellas Incorporated serves residents of Pinellas County that are visually impaired or blind. Services include rehabilitation. Education is a fundamental aspect of child development and enrichment. Largo, Florida has many private, public, and charter schools available for the children of the community. Sanitation services in Largo, Florida are mostly provided by Pinellas County. Water supply and quality is managed by Pinellas County Utilities. Water is treated with clarification, ammonia, and sodium hydrate. Law enforcement, as well as animal control services, are a vital resource for any community. Most calls to the police force in Largo over the last month were related to traffic. Largo Fire Department responds mostly to calls of a medical nature, as well as fires, vehicle fires, and traffic crashes. Services include fire inspection, CPR training and first aid. Disaster planning and zoning is available through the Pinellas County Emergency Management page of their website. Disaster planning advice as well as emergency items to prepare may also be found. Evacuation. There are many recreational and community centers in Largo, Florida. Largo Central Park offers toddler and youth gymnasium equipment, swings, a nature trail, and rentable shelters. Government and public policies are overseen by public officials. In Largo, Florida, the current elected mayor is Woody Brown, and the term of office is 2 consecutive 4-year terms at a time. The economics of government and public policies for the City of Largo, Florida are provided in the table below and include funding sources for the community as well as budget allocation of funds resources. A nurse's role as patient advocates for community health is an important one. According to one journal, nurses are well positioned to contribute and lead advocacy roles to transform healthcare due to their role, education,